is an independent nonprofit community-centered research institute based in Washington, dedicated to producing fact-based analysis that drive impactful interventions, programs, and solutions. Committed to impartiality, PR employs a human-centered design approach, emphasizing the value of contextualized knowledge to better serve communities. Founded in 2022 in Washington, PR was established with the vision of a world where no one's dignity or rights are compromised in social decision-making and service delivery due to misinformation, disinformation, or lack of systematic information. Today, PR remains steadfast in its mission to deliver evidence-based insights that inform policies, programs, and services to tackle critical community challenges. I'm honored to be joined by my two brilliant colleagues, Shalom and August. Shalom Malanga is a recent MPH graduate in health system and policy from the University of Washington, with experience in legislative research, health policy analysis, and community-based work. Her focus is on improving healthcare access for immigrants and underserved populations through systems-level change. As part of her graduate training, she led a mixed method of study on how language barriers affect healthcare access among Congolese immigrants in Washington state. She continued to build on that work through the Pursuit Policy Research Institute, where she has expanded the study into a broader report on access to housing and emergency services. Rooted in both research and real-world impact, Shalom's background spans policy tracking, stakeholder engagement, and public health communication. She is especially drawn to works that connects strategy with community needs. When she is not deep into policy and in health policy, you will probably find her bringing a reality show, planning her next trip, or getting lost in a good sci-fi or dystopian book. Now, to Agus. Agus Vega, him is a non-binary family physician from South America with a Master of Public Health and in Global Health. He has extensive experience working with minority populations, including LGBTQ+ individuals and survivors of intimate partners violence. Grounded in social justice, August's research employs both qualitative and quantitative methods. His work spans topics from abortion access in Argentina to gender-affirming care in the United States. He currently serves as a data analyst at Pursuit Policy Research Institute, leading a project that examines how language exclusion and systemic barrier affect access to housing and healthcare for immigrant and refugee communities. With that, I will now turn the mic over to Shalom and August to begin their presentation. Thank you all so very much. Very happy and pleased to have you all. Shalom and August, now please take it from here.
Hello, everyone. Thank you all for joining. I am super excited to be presenting this study with you guys. Before we start, we would like to begin with a land acknowledgement. I want to acknowledge the indigenous peoples who have stewarded the land on which this research was conducted and the land that we occupy. We thank the Coast Salish peoples whose land touches the shared waters of the Duwamish, Puyallup, Suquamish, Tulalip, and Muckleshoot nations for their enduring protection of this land. Now, this work would not have been possible without the partnership and trust of the Congolese community in Washington. First, we want to express deep gratitude to the Congolese Integration Network, or CIN, who served as a core community partner throughout this entire process. Now, their guidance really helped ensure that the language, framing, and approach of this study remained respectful and grounded in community needs. We would also like to thank Dr. Hendrika Mishik, my faculty capstone advisor, for her mentorship and support throughout this whole project. And her insight really helped ensure that this research remained both academically rigorous and deeply community informed. And most importantly, we want to thank the Congolese participants themselves for sharing their stories, for making time to participate in this research, and for helping circulate the survey within their networks. Your voices are at the heart of this work. Now, before we dive into the study aims, here's a quick look over the flow of today's presentation. We'll begin with some background and context information, then move into the overview of some methods, including survey design and analysis. Now, the bulk of the presentation will focus mainly on our results and discussion, where we'll walk through key findings on demographics, housing access, and healthcare access, and we'll wrap up with few final reflections. Now, this study draws on data from a community-informed survey exploring how language barriers shape Congolese immigrants' experiences with healthcare and housing services here in Washington State. It was developed through a collaborative process that centered community voices with a focus on both structural barriers and potential solutions. Now, our four main study aims were one, to examine demographic characteristics of Congolese survey participants. Second, it was to understand how they navigate healthcare and housing systems. Third was to document the challenges they face, especially those tied to language barriers. And lastly, it was to highlight promising practices and share, some recommendations that support more equitable and linguistically inclusive systems. Now, this broader study also, again, informed a more focused version that I completed for my MPH program, which zoomed in specifically on healthcare access. Now, before we get into it, let's contextualize everything and get a little bit of background information on why we did this study. So, first of all, this map here, it helps us understand the scale of crisis in the Democratic Republic of Congo, or DRC. And since the 1960s, the country has experienced ongoing instability, especially in the eastern regions shown here in red right here. Violence intensified in the late 2023, displacing hundreds of thousands with limited access to food, shelter, or aid. And today, the DRC has Africa's largest internally displaced population, with over 6.2 million people displaced, and many flee across borders into neighboring countries like Uganda, Rwanda. And for some, this long and uncertain journey ultimately leads them to resettlement in places like Washington State. So to better understand this journey, this timeline here breaks down displacement into six phases, beginning with conflict and instability, again, that has displaced over 6 million Congolese people since the 1990s. By 2018, the DRC became the top country of origin for U.S. refugees, and Washington State actually emerged as a key resettlement site. But arrival doesn't mark the end of struggle, right? We all know this. Many face steep integration barriers, particularly, again, language barriers, and that can delay access to healthcare, housing, and stability. Even long-term residents continue to encounter gaps if early supports were lacking, or if they remain in under-resourced communities. So now that we've covered a little bit about why families are displaced, let's focus in on what they face once they arrive, starting with the healthcare system and looking at Washington State's landscape. So Washington State does have a strong language access policy infrastructure on paper, right? Including Medicaid interpretation and state level protections for limited English proficient patients. But in practice, there's still major gaps that persist. There's no disaggregated data by language group, so it's unclear who's being reached. Interpreter availability is also inconsistent, and many providers lack training in offering qualified services, especially culturally relevant, given that many people might have different, language dialects. This pushes patients to rely on family members to interpret, raising privacy, accuracy, and trauma concerns. Now, digital platforms add another barrier. So, telehealth services may often only be in English or maybe Spanish, right? But making them inaccessible for many Congolese immigrants. Mental health care is even more limited, especially from these people, a lot of them coming as refugees, right? Cultural stigma plus the lack of French or Swahili speaking therapists, for example, leaves many patients feeling misunderstood or unsupported. So, what happens in the absence of this formal support? We see a lot of community workarounds like, Congolese Integration Network stepping in, churches, nonprofits, even children step in as informal interpreters. And while these efforts are driven by care and they do carry some risks and add burden to families and these communities. So the takeaway here, right, is even though policies do exist, language access still remains a daily barrier in practice. Now, turning to the housing system, because language access is a housing justice issue too, right? While there are federal civil rights protections, implementation is still a bit patchy, and we do see some counties that have adopted protocols, but many tenant-landlord interactions still happen only in English, and that creates legal vulnerabilities. Tenants, for example, may unknowingly sign leases or miss deadlines because they simply can't understand the paperwork. As housing moves online, language becomes an even bigger barrier. Many platforms aren't translated, and even English-speaking users find them hard to navigate, let alone someone unfamiliar with the US systems or digital tools. So once again, informal networks step in. People, rely on WhatsApp groups or community leaders to translate and help resolve disputes. But this isn't sustainable and it adds emotional labor to already strained communities. Now, Washington has made some amazing progress on protections like just cause eviction laws and COVID era rental aid, but outreach isn't always language specific still, and appeal processes are still rarely navigatable in these common languages spoken by these African countries like and Congolese languages. Now, this project began with a simple but important question. How do language barriers shape access to essential services for Congolese immigrants and refugees here in Washington state? When I first started planning the capstone project, I knew I wanted to focus on immigrant and refugee communities, especially since there isn't a wide known data set, especially with the Congolese population exploring this. Now, early conversations with public health professionals and community organizations made it clear that this was a structural issue across both housing and healthcare systems, and partnering with the Congolese Integration Network was foundational in helping shape the whole process. In that, we designed a 36-item survey targeted at Congolese-born adults living in the state. The participants had to be aged 18 or older, have lived in the state for at least 6 months, and identify as immigrants or refugees. And these criteria really helped us focus on people most likely to have experience engaging with state systems and the language-related barriers that can come with that. The survey contained four key areas: demographics, healthcare, housing, and emergency services. And within each section, we asked targeted questions about language access, including interpreter use, availability of translated materials, and whether people felt they could fully understand or respond to key information. This also had both multiple choice, likelihood scales, and open-ended questions. We built the survey in Microsoft Forms and it was translated in English, French, and Swahili with the help from translators from the community through Congolese Integration Network. In total, we received 964 responses. 961 were valid and making this one of the largest known state level data sets focused on Congolese immigrant experiences in the US. Now, for data collection, we leaned into a more community-driven approach. Again, CIN helped circulate the survey, and that intentional strategy allowed us to really reach people who may have been overlooked through more traditional recruitment methods. And to encourage participation and show appreciation, we offered a $15 gift card to the first 70 eligible respondents. But more importantly, our outreach, we wanted to emphasize that this study was created for and with the community, and that their voices would directly inform policy and advocacy efforts. After data collection, we move on to analysis. Um, August was great in this and led our quantitative analysis portion of this. And from there, we used R to conduct the descriptive statistics to understand the sample's demographic characteristics and identify patterns, things like that. Again, for the qualitative portion that we utilized, used Deduce to use decode and analyze transcripts from our three community leaders. And these narratives really helped us stay grounded in lived experiences and provided that important nuance to what we were seeing in the survey data, which was also integrated with quotes and everything in the final analysis. Now that we've discussed how the study was designed and how it was collected, let's move into what we actually learned from the survey. We'll start by understanding who the survey was looking at, the key demographic patterns that help us better understand the findings, and we'll also dive into especially the healthcare and housing access findings. So, the data points offer more than just numbers in this findings. They help contextualize the lived experiences that we'll talk about in a second. And the findings in this section are based on the survey responses from 964 Congolese immigrants and refugees residing here. And to better understand how language proficiency might influence lived experience, we stratified key demographic variables by English proficiency. But overall, we found the profiles between English proficient and non-proficient participants pretty similar, largely similar. There were differences that did show up, like insurance coverage and languages that were spoken at home. But across age and employment and education, the patterns were pretty consistent. So for now, we'll focus on describing the full sample. Starting with gender, about two-thirds of participants identified as men, while just under one-third were women. And that might seem like an imbalance at first glance, but it's not uncommon in immigrant communities. In many households, men are more likely to serve as a point of contact or engage in formal service like this. So it's important to keep in mind that context too. And migration patterns also play a role. Employment-based and diversity visa routes tend to be more accessible to men. So while refugee resettlement often involves entire families, so th this likely reflects a mix of those two, who's migrating and how household structures are structured and connected to community networks as well. When looking at age, the majority of respondents were between 25 and 44, prime working ages, right? So that's significant because people in this life stage are often raising families, working with and interacting with systems like healthcare, childcare, and housing. And fewer respondents between 18 to 24 or over 45, which may reflect migration patterns as well, but also outreach because most people um, connected to civic life and services are most reachable. Education was another important theme. Over 400 respondents reported having college degrees, and many others had completed vocational training or some form of higher education. Now, that's a powerful reminder of the human capital in the community, right? But it also raises important questions. Are these qualifications being recognized? Why are they not? And are people able to use their training in the US? One community leader captured this issue perfectly when they said, most of our education doesn't transfer. We can't continue the same jobs we had back home, like my dad, for instance, who went back to school at 50. I was in the school and my dad was literally my classmate. That kind of set us back, and it sets many people back. If you have to work to pay your bills or maintain your home, that means you don't have time to learn or go back to school. It traps you into a poverty cycle where you're not advancing your education and not putting yourself in a position to earn more income. So, as you can see, it's not just about job titles, and this is a mismatch that affects income, housing stability, and access to benefits like employer-sponsored insurance, for example. Employment patterns followed a similar thread. We see that most respondents were working either full-time or part-time, which shows strong labor force participation, right? But again, work doesn't always mean stability, and many immigrants take on roles below their qualifications or face language-related challenges that impacts job security. So this needs to be reflected not just in numbers. In numbers, we can see, oh, okay, people are working or employed, but that's not reflective of stability. One community leader described a community member who lost a housekeeping job simply because he couldn't respond to walkie-talkie instructions from his manager. He said it's a challenge to find employment if you don't know the language. For example, there was someone who got a housekeeping job, but the manager was trying to communicate with him over walkie-talkie, and he couldn't respond because he didn't speak the language. The manager said, I can't keep someone like this, and let him go. It's a small detail, but a clear example of how communication barriers can have real life consequences. We also look at how long participants had lived in Washington. Now, most of them had been here for over a year, with many reporting 3 or more years of residency, but nearly 20% of the sample were newer arrivals, having come within the past year. And that matters because the length of time in a new place shapes how people interact with systems. So newer arrivals are more likely to face steep and, challenging um, obstacles from language learning to navigating bureaucratic systems and often lack strong social networks. But even long-term residents may continue to face barriers, especially if that early support was lacking and was not there. And so that's why integration shouldn't just be that one-time event. It really should be an ongoing process that requires long-term cross-sector work across a variety of sectors. Finally, we examine language use, and just over half of the samples said they speak a language other than English at home, while just under half primarily spoke English. That near even split reflects a deeply multilingual community. And while English and French were the most common, we also saw Kikongo, Lingala, Swahili, and even Portuguese. And these patterns reflect not just heritage, but migration journeys. For example, Portuguese speakers may have passed through Lusophone countries before arriving in the US. This tree map offers a visual snapshot of the many language combinations spoken at home by respondents, underscoring just how linguistically diverse this community is. You'll notice English, French, Kikongo, Lingala and Swahili appear most frequently, often in combination, right? So this linguistic diversity highlights the need for public-facing systems, from healthcare to housing to emergency services that recognize and accommodate a wide range of languages in day-to-day practice, not just in principle. So, in summary, what we found was a young, highly educated, multilingual, and working age population full of people navigating these complex transitions, often with limited support. And these demographics shape both the community's challenges and its capacity for contribution. So, as we move into the next section that Agus is going to present on healthcare access and the outcomes and housing, this context really gives us a deeper lens to interpret what the data shows and what it means for policy and practice.
Thank you, Shalom, for your presentation. And let me share my screen. I want to make sure that everybody can see my screen accurately. Give me just 1 minute. So we want to thank you all for staying at this point of the presentation. And now we want to transition to the housing access. In this section, we will explore the housing experiences of Congolese immigrants. Particularly, we want to deep into the challenges they face upon arriving in the United States, and all these structural and systemic barriers that shape their access to a safe and stable housing. So let's begin with the initial phase of the resettlement, which is finding a place to live. When newcomers arrive, the housing search can be very complex, right? So especially when they are navigating an unfamiliar system. We wanted to understand who supports the Congolese immigrants during this critical period. Our findings show that most respondents, 50% of the sample, rely primarily on family and friends to secure housing. So this informal support network was the most common source of housing assistance for the Congolese immigrants. An additional 30% relied on a resettlement agency. Community groups also played a vital role, supporting 14% of respondents. And while a few managed to find housing on their own, these cases were the minority. One community member mentioned, "Looking back now, I see how crucial was my family's support in helping me find a place to live. They helped translate not just language, but culture. With their guidance, I found stability sooner than I might have alone." This highlights how important informal support is during the resettlement process. To better understand the impact of language, we divided our sample based on English proficiency. Interestingly, support sources were fairly consistent across both groups. Whether respondents spoke English fluently or not, most turned to their existing networks, such as family, friend, and a resettlement agency, to find a place to live. This suggests that social and institutional relationships are more influential than the language itself when it comes to initial housing access. Now, even when formal housing program exists, accessing them isn't always a straightforward process. Almost 90% of participants were aware of housing assistance programs, but surprisingly, more than a half of them have not used them. And another 14% of the sample, 130 individuals, didn't know that the programs exist. So we found a gap between program awareness and program utilization. And this gap highlights a critical disconnect. So we should ask us why? What is preventing them from using the programs? Because it's not simply about knowing that the help exists. It is about being able to engage with those services. Challenges like complicated eligibility criteria, language barriers, and cultural mismatch may discourage people from seeking help even when they need it. We then explore how difficult it felt to secure housing in practice. Participants with higher English proficiency were significantly more likely to say that the process was easy. We can see here them in orange. Those with limited English proficiency were much more likely to report that this process was very difficult or somewhat difficult. This difference is statistically significant and reinforces the idea that language matters, not just in communication, but in navigating systems, understanding the paperwork, and advocating for oneself in an unfamiliar setting. To dive deeper into this issue, we asked about two specific types of language barriers. First, written documents. Rental agreements, leases, and housing forms were frequently reported as being available only in English. We asked participants if they faced challenge because documents were only in that language. Nearly 800 of participants, which is almost 90% of the sample, said that they encountered this issue either often or sometimes. Second, verbal communication. We asked if they face challenge communicating with landlords or housing staff. Over 3/4 of respondents describe challenges when they're trying to speak with the landlords or housing staff. These results point to a need for consistent language support, not just during the initial resettlement process, but across every stage of the housing process. Beyond language, other deeply rooted barriers emerged from open-ended questions in the voices of the participants. Racial discrimination was repeatedly cited, with participants saying that they were dismissed or denied housing based on appearance or assumptions based on race. A strict landlord screening criteria, like high credit score or proof of steady income, created further roadblocks for Congolese immigrants. Cultural unfamiliarity and system complexity added layers to confusion and frustration among immigrants. Unaffordable rent and low housing supply were major concerns. And for asylum seekers, bureaucratic delays, especially in obtaining work permits, often made stable housing unattainable. One respondent mentioned, "I was rejected by many homeowners because of my race." Another one observed, "Finding housing was challenging due to the high rent prices and limited availability." And yet, alongside these challenges, we also heard powerful suggestions for change. Respondent and community leaders offered clear and actionable recommendations. Increase financial support and expand employment opportunities for immigrants. Improve agency guidance. Simplify housing application processes and strengthen collaboration between the government and the private sector to make or expand affordable housing. One respondent said it best. "What would have helped me personally is having a housing support system that understood where I was coming from, not just as an immigrant, but as someone trying to rebuild from scratch." That insight reminds us that improving housing access isn't just about policy. It is about dignity, understanding, and the kind of support that meets people where they are. Now we will turn our attention to healthcare access, an area where Congolese immigrants in Washington state face persistent barriers with far-reaching implications for individual and community health. So let's begin with the scope of healthcare utilization among this community. We asked participants whether they or someone in their household had needed to use healthcare services in the United States. Over 780 respondents, which is roughly 82% of the sample, said that yes, they needed to use services. These include routine checkups, vaccinations, urgent care visits, hospital services. And yet, despite this need, healthcare insurance coverage remained uneven. According to our data, 41 households report full coverage, but 45% of them said only some members had insurance, and 13% households had not coverage at all. So while the demand for care is very clear, many Congolese families remain unprotected and potentially at risk of financial risk. We also look into how Congolese immigrants navigate medical care with a focus on interpretation services. Near 2/3 of the respondents said that they rely on interpreter services during medical visits, either always, this 90%, 19%, or sometimes, this 46%. This underscored a fundamental truth. Language access is essential for them for making informed decisions and engaging fully in one's care. Yet the presence of interpreters doesn't always solve the problem, because several participants described experiences where messages were distorted or misunderstood while they were using interpreter services. One heartbreaking example came from a community member who said, "If I lost my pregnancy, it is because I wasn't understood properly." We want to understand how deeply language barriers affect behavior. So we asked whether participants or anyone in their household had ever avoided seeking medical care because of difficulty on communicating in English language. The results, nearly half said yes, they avoided care. That is almost 500 individuals who chose not to get care not because they didn't need it, but because the language barrier felt overwhelming. When we look at this by English proficiency, the difference was stark. Healthcare avoidance was significantly more common among individuals with limited English proficiency, as we can see here in the darker red. This mattered tremendously because healthcare avoidance can lead to misdiagnosed, unmanaged chronic conditions, and avoidable emergencies, all which impact health and strain resources. Understanding what drives this avoidance, it is essential to designing effective equity-driven interventions. And to explore this further, we examine barriers across 3 dimensions of the healthcare communication: the ability to express symptoms and health concerns to a provider, the ability to comprehend during appointments, and understanding written medical instructions. We found that more than 70% of respondents face challenges across all 3 communication dimensions. One participant shared, "Even though I speak English, I struggle to explain myself in a way that made doctors understand what I was going through, especially when it came to emotional or mental health." And this reflects a broader issue because communication gaps jeopardize care quality and patient outcomes, even for those that are known for speaking in English. But language is just one part of the puzzle. Participants also shared other challenges, like financial constraints and high cost of care, complexity of navigating a system that sometimes is fragmented, long travel distances or lack of transportation, racial bias and discrimination in care settings, and significant delays in securing appointments even when they had urgent needs. One community member said, "People of color often receive lower quality of care and face discrimination on bias in medical settings. Some people have been here for months and they've never seen a doctor, not because they don't want to, but because they don't know how." Importantly, participants often thoughtful recommendations to improve healthcare access. Make healthcare more affordable. Streamline processes and reduce administrative complexity. Increase virtual consultations to reduce transportation burdens. Provide consistent interpreter services. Prioritize cultural competent care and offer transportation to reach clinics and appointments. These aren't just suggestions. They are community-rooted solutions shaped by the lived experience of Congolese immigrants navigating the healthcare system in Washington state. So now before we present our conclusion, we wanted to acknowledge some limitations that are inherent to our research. First, the recruitment via the Congolese integration networks may have disproportionately reached individuals who are already socially connected, which could skew our representation. Additionally, self-reported data carry risks of bias and misinterpretation, such as social desirability bias. Some participants also reported that they did not speak the languages in which the survey was translated, suggesting potential challenges in understanding the questions accurately. The digital format may have excluded those with limited with limited internet or tech access. We did not conduct a detailed analysis by length of stay in the US or currently living location, both critical contextual factors that may shape how individuals interact with services and limit our ability to offer targeted policy recommendations. Lastly, because this is a cross-sectional study, we cannot make causal claims, only observe associations and patterns. Despite the mentioned limitations, the findings provide meaningful insights that can guide more inclusive and responsive services moving forward. First, we can see that structural barriers, especially language barriers, continue to limit access to both healthcare and housing. Compliance with access laws isn't enough, as real inclusion requires systems built with empathy, nuance, and cultural relevance. Second, we must reimagine the healthcare support. Language services should be routine and not reactive. Community health workers must be multilingual and culturally informed, and digital tools co-designed with Congolese stakeholders can bridge communication gaps. So we must invest on those. Third, many immigrants still lack access to translated materials and legal support, especially in housing systems. So we must support peer-led navigation and culturally specific partnerships. And finally, informal support like family, friend, or community groups often serve as safety nets and reduce barriers. Supporting and expanding these networks may be just as vital as strengthening formal institutions. Tailored outreach is critical, especially for youth, elders, and newcomers without strong support networks. And equity requires a relational care, not one-size-fits-all solutions. So this study draws on responses from 964 Congolese immigrants, offering rich insights into how language influences the daily experiences across core aspects of the resettlement, from accessing to healthcare to navigating housing. What emerged is not just a set of data, but is a portrait of a resilient and resourceful community, often overlooked in mainstream planning and policy discussions. By placing Congolese voices at the center, this research bridges gaps between empirical evidence and lived experience, providing a powerful foundation for designing services that are not only inclusive, but linguistically and culturally responsive. So we want to thank you all for staying to this point of the presentation, and we are open to hear your questions, your comments, or concerns.
Excellent. Thank you guys so much. Yeah, we would love to have questions and thoughts and suggestions or comments. Please feel free to unmute yourself or drop your question in the chat room. Thank you so much.
Okay, we have a question in the chat. Venetia, sorry if I pronounced your name wrong. How did you find the participants? Sorry if you're already discussed. Um, yeah, so how I found the participants. So first of all, like I said, we said the Congolese Integration Network was a very big part of the collaboration process. And after the survey was designed, they helped with the outreach, sharing it with refugee case manager, for example. Another um, area that we did was share with church groups and in WhatsApp groups. And that got shared around with the Congolese community, and that helped get the word out as well. So those were the two main recruitment methods for the participants. As far as the interviews that we conducted with the community leaders, those mainly came from the connection we had again with CIN. We had most of the members from there, as well as another member that worked at a different community-based organization.
We have Francois. Please feel free to unmute yourself and speak. Thank you so much.
Yeah, mine is not really a question. I just wanna really say thank you for the work that you did, the research that you did. This is amazing because we have been working, but we did not have really data that shows the challenges that the Congolese immigrant and refugees are facing. Like last Thursday, I had another presentation with the King County Board of Health. But since you said don't share, so I read this, but I did not share, although it has a lot of information in there. But I did not share it. I had to respect what you told me to do. But I'm really grateful for the work that you did. And this is really a tool that will help us to do the work that we have been doing for the Congolese immigrant and the refugees. Really, we appreciate that, the research that you did. Thank you.
Thank you so much, Francois.
Mhm.
It's a pleasure having you be a part of the process.
Thank you.
Yeah, I want to say thank you for your kind words, Francois. And I'm checking right now that Efan is sharing the link to the full report that just been published in the webpage of the Institute. So everybody could access there,
Yeah,
just following the link.
Thanks.
thank you, Agnes. Yeah, we just released the report on the website. So we have folks working behind the scene. They just put it out there. And also, I just copied the link here. Thank you, Riza, if you hear me. I know you're working on the back end. Thank you so much. They just put out the report, and I shared the link here. So you can access the full report here. And we would be very happy to keep this conversation going. If you have any question, if anybody has any question, any comments or suggestions, we would love to keep this conversation going and coming up with some insights that's helpful to serve the community better. Dr. Sam, I think you have a question. Please feel free to question or thought or suggestion. Please feel free to unmute yourself or speak up. Thank you so much.
We cannot hear you, Dr. Sam.
Oh, it's still mute.
Yeah, okay.
Okay.
Yeah, we can hear you.
Okay, great. Yes, I want to thank you actually for this presentation and these two scholars. I'm so grateful. And this one of them is my daughter, Shalom. So hands up for what you are doing, you guys. So my question is, after the research that you have made, are there some things that you actually recommend to the government or federal so that some of those issues, because the Congolese migrants, they are actually facing some of the challenges. I heard someone saying some they want to go to the hospital to see these doctors, but they are not able to. They don't know how. So, do you have, or have you actually got some channels how these communities can actually reach out and be seen and be addressed as their mitigations for health care? Are there some things that you have done or avenues that can be opened so that such kind of challenges can be addressed?
Mm. Good question. Well, to start, yeah, we explored a lot of different policy implications and different ways that we could, use the data that we got to improve the lived experiences for this community. And I think one thing that came up for me was to really have local government and state governments investing and collaborating with organizations and community organizations like, Congolese Integration Network. We see that a lot of, you know, people in this that come in, especially immigrants and refugees that do not have that formal support system, find it a lot harder to integrate and access these services. And these organizations do amazing work to help, their own community. So I think really finding a way to make sure that whatever programs or policies that are being implemented across like language access, that they are being these community organizations are being included in the process. And another thing that I kind of explored more so on my capstone project was how technology and like AI could kind of bridge this access gap. And I think that's a powerful new age that we're in now with technology, right? And so it holds a lot of promise, especially in like translating certain things. Like let's say you're on te a telehealth appointment and you need a translation with like a chat bot, AI could come in and help in those areas. However, remaining, grounded in that ethical considerations, making sure, data privacy and that bias and fairness is there as well. But I definitely think that's something that could be leveraged too. I goes like you can be free to express as well, but yeah, that's kind of something I got.
Yeah, and we also consider that as our data show that it has to be a continued process. You not only have to target it recent newcomers, but also those who have been living here for longer, because maybe those are the ones who are being exposed the most to the healthcare or the housing system struggles. So we have to continue providing support along the way into the entire process of resettlement. It's not just the beginning, it's a continue and long process until you get the same rights and the same status as the people that live here for a longer time. So also we notice that some people are more disadvantaged in regard to others. For example, our data show that youth, women, and elders are less represented in our data. So is that a truly picture of the demographics of the Congolese immigrants in the Washington state, or it is because they are less represented in our data because they are less connected, because they have not access to digital tools, because they have not access to networks as the male and working ages people that they responded our survey. So we need to find those people in more need and emphasize our efforts and put more culturally tailored approaches in those communities, because we notice that as the migration patterns are looking in the US currently, we don't lack of women and young people. It's not that we cannot reach them, even for elders. So they are there, but they are not being reached by the program. They are not being reached by the community organizations. So we need to put more emphasis on that population.
Mhm. And one last thing I wanted to add too, in terms of policy, I think policymakers need to also strengthen enforcement on like language access laws by requiring like outcome evaluations or not just like provision of language services. So really expanding the definition of access to include, dialect variation, cultural nuance, things like that. So agencies shouldn't just, fund interpreter training programs that are tailored to lesser resource languages, it needs to be more inclusive.
Thank you. Actually, just let me reflect a little bit about, the education part, this continued collaboration and education of community education. From what really I understood during the time that I have had the chance to work with the immigrant population, I think there is a huge gap in community education or focusing on community education from the service providers, I would say, for the communities. What happened in the United States, the entire immigration policy has somehow really is influenced by the foreign policy of the United States, which makes the integration of the immigrants in a kind of a fragile moment or situation. The reason is that if we don't have an independent integration policy of the immigrants in the United States, we are lacking that consistency. That's why all the services provided to the immigrant communities are mostly resettlement services, not integration services. There is a huge difference between these two notions. The resettlement process basically kind of responds to the very immediate needs of the communities, like housing, like healthcare and stuff like that. But if you want to really integrate, if you want to provide integration services for a longer term, for the communities to thrive, both, it is really useful for both the host communities and also for the immigrant communities, is to have that continued collaboration and support and continued, I would say, a clear integration mechanism and policies in place with some local and federal support that can, that could be really impactful. I think that's what we're lacking in the United States. If you see Australia, if you see New Zealand, and even Switzerland, which has probably the largest immigrant population in the world, they have really a kind of a comprehensive integration policies compared to the United States, especially when it comes to the language, when it comes to the system education, for instance. Immigrant populations, when they get here, they don't really know how the system works here. Understanding the health system in the United States requires a lot of effort, a lot of education. Even people who lived here for about 10 years or so, they have really a very limited understanding of this system because these systems are complex, huge, and it requires a lot of efforts to understand that. And how would that impact the future generation? It is another question. Just imagine if a parent, somebody if a mom or a dad, they don't know about the education system, how would that lack of education impact their kids in the next generation? These are some big questions. I think it is ahead of I would say, the service providers in the United States, including the U.S. government, to see really the integration of the immigrants in a very comprehensive way, rather than really kind of a short-term interventions and based on a really kind of a traditional policies and not really community-informed data or perspective or based on the recent needs and challenges that the communities are encountered by. I thank you for asking that question. That's really a crucial question. Appreciate it.
I'm noticing a question of Venecia. I think it's more than like an acknowledging, and Venecia is saying, sending this research to our Office of Housing here at the City of Seattle. Thank you so much for this important research. Also, great consideration for us when updating to our top language report of Seattle in 2026. Oh, thank you so much, Vanessa. I think that's an amazing contribution that we can make with our research, hearing which other languages are deeply rooted in this community that shows a greater resilience. Imagine all these people that already speak more than 3 or 4 languages, some of them, and they have to come a new place and start to know another language. So for me, that it is a proof of how resilient is the community and how much they aim to integrate to the US living experience. So I think that's really important to have into account. And I just tried the link and it works for me. So I will just resend the link with you, Venecia, here in the chat.
It might be a firewall issue as well. But we would love to share the report via email as well. If you could kindly provide your email, then we would love to provide you and send the report, the full report via email. Thank you so much.
Any other questions?
We also are eager to hear from you any suggestions for improving these efforts moving forward, or as well, if there is a community member there that can reflect on the experiences shared, or maybe can resonate, or like found something that it is not resonating with them at all. That is also a good contribution. And we aim that not only here, but maybe just via email or after reading the full report. If you have any questions or comments, also, we would highly appreciate your input.
Yeah. Well, fantastic. Well, thank you guys so much. Thank you all so much for your support, for your participation and your thoughts. We would love to continue this effort, and we are looking forward to further collaboration and conversation among stakeholders. Yeah, I think Marsha. Okay, Marsha, I see you have a question or thoughts. Please feel free to unmute yourself and
Yeah, thank you. Thanks for the great presentation. Unfortunately, I was multitasking. I missed some of it, so I look forward to reviewing the report. Sorry, my video is going in and out. But my contribution was just more in acknowledging a lot of what you shared. I think the barriers that are known beyond just the Congolese. I'm a community leader within the African communities, and I actually was talking to somebody who is recently moved to the area, and they were just sharing. And she's an expecting mom, and she was just telling me how her appointments are very complicated because of her strong accent and not being able to interact with the doctor in a way that's easy for her to understand what's being shared, and then the use of tools like what do they call that my chart where they put the results, and she's having a hard time navigating all that and not feeling like she has support. So that was something that you really don't think about it, but she's somebody who's relatively well educated, speaks, above average English, but still facing these barriers. So definitely something that I'm seeing. So just wanted to thank you for that. A lot of what you shared is definitely relatable and well researched. Thanks.
Thank you so much, Marcia. But yeah, I definitely agree. I think I've seen a lot of these experiences reflected across other populations too, not just the Congolese community. So yeah, it just highlights a real barrier that's there, right? And hopefully this work can inform more and other research and studies to help bridge this gap.
And did you share, is this something that you, upon request, can share with other groups, or because
Yeah.
there are some events that okay, so I'll reach out because there's some other groups I think would be benefit from just
Yeah.
having this shared with them. Things.
Definitely, I think that many of these challenges are not faced alone but this Congolese community. I came from the Latino community and I worked for a year with Latino communities living in Washington. And as Shalom shared at the beginning of the presentation, many services are already translated into Spanish, but we encounter other issues, which are like the cultural nuances are not being reflected in this translation sometimes. Digital tools are not very useful in Latin American context. Where I came from Argentina, we don't have my chart. We don't have access to phone devices with that technology that allows us to engage properly with the technology that it is in the US. So I know those tools need a lot of improvement to be accessible and be connected with the culture for many other immigrants, and not from far away, like just Mexican immigrants or Latin American immigrants that they live very close to the United States. There are still digital barriers that we cannot see when we design these programs. So we have to put more emphasis, and as this quote that it is sharing the screen said, like, even though I speak English, it is very difficult to communicate my emotions, my culture, my trauma, my background, and that for people who is seeking mental health care is an extra burden, and that people is more underprotected. So we need to put more effort also in that people, the people who is looking for mental health assistance, which oftentimes lack of the cultural nuance that we require to fully understand the problem or the issues that are coming with the immigrant resettlement process.
Excellent. Well, thank you so much. We have time, but I think we give you guys back more like, minutes, and thank you so much for your continued support and participation today. We would love to continue this conversation and many other similar conversations and research efforts. We'll keep you guys posted with the updates on the report through the emails that you have registered. We will share that through email as well, so that nobody misses having access to the full report. Thank you all so much, and you have a great rest of your day. Appreciate it.
Thank you, guys.
Thank you so much. We appreciate you all.